Thank you for participating in the Healthy Childcare America Back to Sleep campaign, Reducing the Risk of SIDS in Childcare. The purpose of this training is to help you protect the children for whom you care by creating a safer sleep environment to prevent sudden infant death syndrome. My name is Tina, and this is presented to you by Networx, LLC. This presentation has been made available by the Healthy Childcare America Back to Sleep campaign, sponsored by the U.S. Department of Health and Human Services. It is designed to build on the successes of the Healthy Childcare America Back to Sleep campaign. Launched in 1995, the Back to Sleep campaign was a focused effort of several national organizations working to educate the public about the importance of putting babies to sleep on their backs to decrease the incidences of SIDS. The Healthy Childcare America campaign, launched in 1995, is a collaborative effort of healthcare professionals, childcare providers, and families of children in childcare, working in partnership to improve the health and well-being of children in childcare settings. The campaign is coordinated by the American Academy of Pediatrics. Through this joint campaign, all partners will offer technical assistance and resources to promote back-to-sleep messages in childcare programs, raise awareness and change practices in family childcare homes and center-based childcare programs, and encourage states to include safe sleep practices within state childcare regulations. By the end of this session, you will be able to define SIDS, identify behaviors that increase the risk of SIDS, discuss common myths about SIDS, and be familiar with resources to help you reduce the risk of SIDS for infants in your care. So what is sudden infant death syndrome? It is the sudden death of an infant under 1 year of age, which remains unexplained after a thorough case investigation, including performance of a complete autopsy, examination of the death scene, and review of the clinical history. SIDS is a diagnosis of exclusion. This means that all other possible causes of death are ruled out before you can call it SIDS. A SIDS diagnosis takes into account autopsy findings, results of the investigation of the place where the baby died, and a review of the baby's medical history. Sometimes the family's health history is also reviewed. Unfortunately, while there is a lot of research being done about what causes SIDS, researchers still do not know what exactly causes SIDS. Therefore, we are not able to predict which babies will die from SIDS. 2/3 of U.S. infants younger than 1 year are in non-parental child care. Infants of employed mothers spend an average of 22 hours per week in child care, and 32% of infants are in child care full-time. The actual rate of SIDS deaths in child care is more than double the expected rate. 60% of these infants die in family child care, 20% in child care centers, and the remaining 20% in relative care. Infants who die in child care tend to be white with older, educated parents. This is noteworthy, as those characteristics are those of infants who would typically be characterized as low risk for SIDS. Just being in child care moves the infant from low to high risk. Many of these infants will die in the first week of child care. What is it about child care that puts babies at risk? Are there unidentified risk factors intrinsic to child care, such as psychological stress, reactions to change in environment? These questions are largely unanswered, but the only identifiable and preventable factor found in studies that is related to child care is unaccustomed tummy sleeping. That's being placed or rolled onto the tummy position when this is not a position in which the infant typically sleeps. A baby is at the least risk of SIDS when placed on the back to sleep, and is most at risk when he or she usually sleeps on the back, but then is placed on the tummy or rolls onto the tummy for sleep. Unaccustomed tummy sleep places infants in out-of-home settings at an extremely high risk for SIDS, almost 18 times the risk of back sleepers. Part of the risk may be because babies who do not typically sleep on their tummies develop upper body strength later than babies who do typically sleep on their tummies. If these infants are placed on their tummies and they get into a suffocating or a low oxygen situation, they cannot lift or move their heads to get out of that situation. So a common question is, what if babies sleep on their backs in childcare and on their tummies at home? If they're accustomed to or used to sleeping on their tummies, as many of these babies are, placing them on their backs in childcare does not increase the risk of SIDS. Childcare providers perform an essential service in our society. More parents are enrolling infants in early education and childcare programs. Childcare providers need to have the most up-to-date information concerning the care of infants. This workshop informs participants about SIDS. Using this information will reduce the number of SIDS deaths that occur in childcare settings. These SIDS facts are based on years of national data that shows which, when, where, and what age and under what circumstances babies die suddenly and unexpectedly. Data is derived from the National Institute of Child Health and Human Development and SIDS researchers. Here are some SIDS facts. SIDS is the cause of death for approximately 2,200 babies in the U.S. each year. That's approximately 6 babies every day. Remember that 20% of SIDS occurs in childcare. This means that 1 baby in this country dies every day while in childcare. SIDS is the leading cause of infant death between 1 and 12 months of age. The third leading cause of infant death from birth to 1 month of age. Before 1 month, babies are dying of other causes. SIDS is the highest risk for infants who are 2 to 4 months old. SIDS is more prevalent during the winter months from November to March. This may be because of overbundling or overheating the babies. SIDS is more prevalent in male babies than female babies. 60% of SIDS occur in males. SIDS risk increase as much as 18-fold when an infant is accustomed to sleeping on the back and is then placed on the tummy to sleep in the care of a person that is not the primary caregiver. Information about SIDS has improved over time through research and data. Some commonly held beliefs about SIDS are not supported by scientific studies. The exact cause of SIDS remains unknown. It is important to emphasize that immunizations or shots do not cause SIDS. Even though the number of immunizations that children get has increased over the last decade, the SIDS rate has decreased. SIDS is not caused by vomiting or choking. It appears that babies who die from SIDS may have a problem with their brainstem development. Studies show that it may be related to serotonin, which is a chemical in the brain that helps to regulate heart rate, breathing, and arousal. Researchers think that babies who die from SIDS have problems with arousal. They can't wake up when they need to, for instance, when their oxygen level is too low. Even though we don't know exactly what causes SIDS and cannot yet entirely prevent SIDS, we know a lot about what the risk factors for SIDS are. Researchers studied SIDS risk factors by comparing populations of babies who died from SIDS and babies who didn't. They look at the characteristics of each group and see which characteristics are associated with SIDS. This is called epidemiology. The good thing about epidemiology is that we can relatively quickly identify risk factors and how they may change with time. The bad thing about epidemiology is that we can't say that a risk factor causes SIDS, but just that it is associated with SIDS. Because we know more about circumstances that increases the likelihood of SIDS, we can take action to modify some of the SIDS risks. Some risk factors can't really be changed, while others can. We'll talk more about some of the risk factors in both of these categories. Research indicates that some infants are at a higher risk of SIDS because of certain risk factors, such as low birth weight, being premature, maternal smoking during pregnancy, multiple births, maternal age younger than 18 years, or less than 18 months between births. So which of these risk factors do you think are modifiable or can be changed? Well, maternal smoking is a major modifiable risk factor on this slide. The other ones can be modified with good prenatal care, counseling, and birth control. But sometimes it's hard to say if a risk factor is modifiable or not. Understanding who is at the greatest risk of SIDS and what behaviors increase the possibility of SIDS helps to guide awareness, education, and training efforts to reduce the risks. With this knowledge, precautions can be taken to minimize SIDS risks for babies in childcare, particularly those who may be exposed to several risk factors. African Americans are at 2 times higher risk for SIDS compared with Caucasians, Asian, and Latino babies. This is also true for other instances of infant deaths, regardless of socioeconomic status. The African American infant death rate is double that of white infants. Some of this risk is probably genetic, so non-modifiable, but some of it is also behavioral, modifiable. For instance, we know that African Americans are more likely to place their babies on their tummies for sleep. The Back to Sleep campaign and other SIDS programs across the country are reaching out to educate and engage the African American community in combating SIDS. Certain American Indian populations have more than 3 times higher risk for SIDS. Nationally, American Indians as a whole are more than 2 times more likely to die from SIDS. The Aberdeen Area Infant Mortality Study, released in December of 2002, indicated that these 3 factors might be contributing to higher SIDS rates in some American Indian communities. That is, secondhand smoke exposure, binge alcohol drinking during pregnancy, and overdressing of babies. Even though African Americans and American Indians are populations that are generally at higher risk for SIDS, it's important to note that Caucasian babies are the ones more likely to die in childcare settings. Mother smoking during pregnancy increases the baby's risk for SIDS 3 times. Besides sleep position, smoke exposure is the most important risk factor for SIDS. Maternal smoking also increases the chances of a baby being born too early and too small. Remember that prematurity and low birth weight also are risk factors for SIDS. Smoking cigarettes during pregnancy negatively affects the brain development of the developing fetus. Babies exposed to smoke don't arouse or wake up as easily as babies not exposed to smoke. So a common question is, what if mother is exposed to smoke during pregnancy? Well, there's not a lot of data, but there is some increase in SIDS risks. It's not as much as if a mother smoked herself, but there is some increased risk. If baby breathes secondhand smoke, there is a 2.5 times higher risk for SIDS. Cigarette smoke contains nicotine, toxic gases, and poisonous chemicals, as well as tiny particles that more than double a baby's chance of dying from SIDS. Creating a smoke-free childcare environment is a critical step to nurturing the health and well-being of infants and toddlers and reducing the risk of SIDS. The risk of SIDS from cigarette smoke is dose-dependent, meaning that the risk is higher with increased exposure. So, if two parents smoke in the home, it increases more than if one parent smokes. Smoking in the same room increases risk more than if someone smoked outside away from the baby. If baby is a stomach or side sleeper, there is a 2 to 3 times higher risk for SIDS. The relationship between a baby sleeping on the stomach and the higher occurrence of SIDS has been documented worldwide. In 1992, based on international research, the AAP began to recommend that babies be placed on their backs or sides to sleep. That message was updated in 1996 when the AAP stated that the back is the preferred and recommended sleep position for babies up to 12 months of age. The side position is not as safe as the back, as the baby can accidentally roll to the stomach, which places the baby at 18 times risk for SIDS. In the most recent studies, side and tummy sleeping have the same amount of increase in SIDS risk. So side sleeping is as dangerous as tummy sleeping. The side position should not be used. If baby usually sleeps on the back or side and then is placed on the tummy, there is as much as 18 times higher risk for SIDS. Parents are getting the message to place babies on their backs to sleep as a way of reducing the chances of SIDS. Unfortunately, the back to sleep message has not reached everyone who cares for babies, including some child care providers, grandparents, babysitters, and other relatives. Babies should sleep on their backs at night and for naps. A common question is, do I need to flip the baby over if he or she rolls onto their stomach? The AAP says that you don't have to. Remember that babies comfortably and consistently begin to roll between 4 to 6 months old, when the risk of SIDS starts to decrease. However, be aware that babies do occasionally still die after 6 months of age. There are many people who don't want to place babies on their backs for sleep, and we're going to talk about some of these in a minute. We're also going to talk about how you can help to address these concerns if parents or other child care providers bring them up. The most common concern is fear that the baby will choke if he or she spits up while sleeping on the back. Healthy babies will not choke if they spit up. Humans have evolved mechanisms that keep them from choking if they are lying on their backs. Millions of babies around the world sleep on their backs without choking when they spit up. Usually the spit up rolls down the sides of the baby's face or is re-swallowed. Research shows that there is no increased risk of choking when a baby sleeps on their back. If a baby has a specific medical condition related to reflux or vomiting, the baby's pediatrician should be consulted about sleep position. The information should be shared with the child care provider. Child care providers should refuse to vary from back to sleep positions unless they have documentation of a child health professional's specific instructions to do so. Some people fear that constant pressure on the back of the baby's head can cause the skull to be less round and flat. Back sleeping can contribute to a flattening of the back of the head. However, this condition generally is temporary. As babies grow and become more active, their skulls will round out. American babies are spending more and more time in car seats, infant carriers, strollers, swings, and bouncy seats, which is resulting in a constant pressure on the back of the head, which also contributes to a flat head. Supervised tummy time, which is time when the baby is placed on its tummy while awake and supervised, and holding awake babies helps decrease pressure on the back of the head. The AAP still recommends that healthy infants be placed on their backs to sleep, but also recommends tummy time when the baby is awake and supervised to decrease the chances of a flat head. If a baby's head is misshapen, a child health professional should evaluate it. Some people fear a bald spot will appear. The loss of hair on the back of the baby's head can be unsightly. As the baby grows, becomes more mobile, and begins to sit up, the hair on the back of the baby's head will have less wear and tear. A bald spot is temporary, and the baby's hair will grow, filling in the bald spot. Tummy time will also help to decrease the friction on the back of the head that leads to the temporary bald spot. We should consider a bald spot on the baby's head as a sign of a healthy baby, one whose risk for SIDS is lower because he or she is a back sleeper. So if it's so dangerous to place babies on their tummies, why do childcare providers do it? There are three main reasons that childcare providers place babies to sleep on their tummies. First, they are unaware of the relationship between SIDS and the sleep position, or they don't think that it's important. Secondly, they are misinformed. They believe that placing babies on their backs to sleep increases the risk of choking or aspiration. They also believe that sleeping deeply is a good thing for babies. Also, if the baby sleeps longer, it makes it easier for the childcare provider. What people believe or perceive to be reasons for tummy sleeping are just not backed by scientific evidence. And lastly, parents ask that the babies be placed on their tummies. Many childcare providers do not feel educated enough to tell parents that it's not appropriate. We need to make sure that childcare providers have the information they need and the support necessary to enable them to talk to parents about this important issue and to refuse to perform what might be a life-threatening practice. This information support may include handouts and written policies. When implementing a new practice in childcare, Caring for Our Children National Health and Safety Performance Standards, Guidelines for Out-of-Home Childcare Programs, 2nd edition, should be consulted. The National Standard on Sleep Positioning is consistent with and incorporates the standards recommended by the AAP, SIDS Resource Center, and the National Resource Center for Health and Safety in Childcare. A copy of the entire publication is available online. There are also standards for cribs and bedding. The standards for sleep, cribs, and bedding are designed to reduce the risk of SIDS and promote children's health and safety while they are in childcare. An abbreviated text addressing SIDS and sleep conditions is also available online. SIDS risk reduction can be implemented in childcare facilities or in the baby's home by incorporating the following three major strategies: tummy to play and back to sleep, safe sleep practices, how the baby sleeps, so this means position, and safe sleep environment, where the baby sleeps, so this means the crib and surrounding area. We'll talk more about these in the next few minutes. It is important for an infant's development to have supervised tummy time. Tummy time is supervised playtime with the child while he or she is positioned on the tummy. By incorporating tummy time every day, we are able to address some of the barriers to placing babies to sleep on their backs, such as flat head and the ability to roll over and sit up. By making sure that babies have supervised tummy time, you're promoting healthy physical development, the opportunity to learn to lift and turn their heads and exercise their bodies, and time to strengthen the neck, arms, and shoulder muscles. This will help to ensure that the baby will reach its developmental milestones of rolling over and sitting up at the recommended time. Tummy time also promotes development by developing the baby's upper body muscles. This enables babies to be better able to lift and turn their bodies in response to sound and other stimuli, thus increasing their ability to explore their world as they begin to connect sight and sound. During tummy time, be sure to keep a watchful eye on babies. Remember, by placing babies on their backs to sleep, you are reducing the risk of SIDS. Don't worry, back sleeping is comfortable and does not require any special equipment. Wedges to keep babies in place are not necessary and are not recommended unless specified by a physician. Tummy time for awake babies and back to sleep promotes the infant's development and safety, including lowering the risk of SIDS. Tummy time is for babies who are awake and being watched. Babies need this time to develop strong muscles for crawling and other movements. Babies should have tummy time right from the first day of life. Interact with the baby during tummy time for a short period 2 to 3 times a day, increasing the amount of time as the baby shows enjoyment of the activity. A great time to do this is following a diaper change or when the baby wakes up from a nap. At first, some babies may not like tummy time position. Place yourself or a toy in front of the baby to play with. Eventually, babies will enjoy tummy time and play in this position. There are lots of ways to play with a baby during tummy time. Place yourself or a toy just out of the baby's reach during playtime to get the baby to reach for you or the toy. You could place a toy in a circle around the baby. Reaching to different points in the circle allows the baby to develop appropriate muscles for rolling, scooting on the belly, and crawling. Lie on your back and place the baby on your chest. The baby will lift his or her head and use his or her arms to try to see your face. While being watched by an adult or caregiver, a young child can play with the baby during tummy time. Young children can get down on the floor easily. They generally have enough energy to play with the baby. They really enjoy their role as a big kid and are likely to have fun themselves. Be consistent. Always put healthy babies to sleep on their backs for naps and at bedtime. It's important to consistently use the back sleeping position for babies regardless of the caregiver. If a baby is accustomed to sleeping on the back at night, he or she should continue to be placed on their back for naps. The risk of SIDS dramatically increases when a baby unaccustomed to sleeping on the tummy is switched from the back to the tummy. Even if the baby sleeps on the tummy at home, it will be safest for the baby to sleep on the back while under your care. Do not have more than one baby per crib. In childcare, each baby must sleep in a separate crib designed for only that child until the crib is sanitized for another baby's use. In addition to sanitation reasons, there is evidence that when there is more than one baby in a single crib, the risk of SIDS is higher. There is a lot of evidence that pacifiers can reduce the risk of SIDS. We don't know why. We do know that pacifiers reduce the risk of SIDS even when they fall out of the baby's mouth after the baby falls asleep. Here are some guidelines for using a pacifier. You may offer the pacifier. If the baby refuses the pacifier, don't force it. If the baby is breastfeeding, wait until the breastfeeding is going well before offering a pacifier. This is usually around 3 to 4 weeks of age. Clean the pacifier often. If the pacifier falls out while the baby is asleep, you do not need to reinsert it. The safest place for a sleeping baby is on his or her back in a safety-approved crib that is free of excess bedding and stuffed animals. You must use a safety-approved crib and a firm mattress. The crib should be safety-approved with slates placed not more than 2 3/8 inches apart. The firm mattress should be a snug fit for the crib, portable crib, or playpen frame. The space between the mattress edge and the crib frame should not be more than the width of 2 adult-sized fingers, and the mattress should have a tight-fitting sheet. Don't ever use a mattress that does not snugly fit the crib or bassinet that you are using. The sheet should be tight-fitting. Don't ever use a different size sheet for the crib or bassinet. It should be designed for that specific mattress. It is best practice to not put babies to sleep anywhere but in a safety-approved crib. In family child care home settings, it is not uncommon to find babies sleeping on a variety of surfaces. Chairs, sofas, waterbeds, cushions, and standard adult beds are not safe surfaces because babies can fall or become entrapped in crevices in the furniture or between the cushions. Although bed sharing generally doesn't occur in child care settings, we wanted to mention this so that you know about it in case a parent mentions it. Bed sharing is when a baby sleeps with another person on the same sleep surface. It may be hazardous under certain conditions and is not recommended by the American Academy of Pediatrics because there is an increased risk of SIDS and other forms of unexpected infant death, such as suffocation. Parents can bring the baby into bed for feeding or snuggling, but should be put back into the crib when the parent is ready to go to bed. There are conditions that make bed sharing especially dangerous, such as sleeping with someone who is not the parent, bed sharing on couches, armchairs, or waterbeds, when the parent smokes, drinks alcoholic beverages, or uses drugs or medication that impair arousal. The safest place for a baby to sleep is in a separate sleep surface next to the parent's bed. Excess bedding and fluffy blankets, comforters, pillows, toys, and stuffed animals can impair the baby's ability to breathe if these items cover the face. Keep all of these things out of the crib. The only thing that should be in the crib is the baby. Consider using blanket sleepers or sleep sacks for the baby instead of blankets if extra warmth is needed. Bibs should be removed before a baby is placed for sleep because of the risk of strangulation. Bumper pads are not necessary. They keep you from being able to see the baby clearly. Babies can also get wedged underneath or against the bumper pads and suffocate. Babies are not big enough to seriously injure themselves if they bump up against the crib. Wedges or positioners are not recommended. There's no evidence that they keep the baby in place, and they can be dangerous. If a baby moves, he or she can suffocate against the wedge, or the wedge positioner can end up on top of the baby. This is a picture from the Consumer Product Safety Commission that shows how a baby should be placed in a crib when put to sleep at night or for a nap. This is called feet to foot. The baby's feet are against the foot of the crib. A single thin blanket is then tucked in under the arm along the side and foot of the crib, so the baby cannot scoot under the blanket, and the blanket does not go up over the baby's head. If you are going to use a thin blanket, you should use the feet-to-foot method. Blanket sleepers and sleep sacks are a good alternative to blankets. Avoid exposure to secondhand cigarette smoke. As we mentioned earlier, exposure to smoke increases a baby's risk for SIDS, as well as other diseases such as asthma, the common cold, and other viruses. We're now going to spend some time talking about developing a safe sleep policy for your center. Both the babies and the child care providers benefit when a safe sleep policy is in place. A child care provider will feel relieved knowing that the practice of putting a baby on its back to sleep is supported by a written safety sleep policy, even if the parents do not perform the same practice at home. There are many benefits to having a safe sleep policy. It has the potential to save the baby's life. It also shows parents that their baby's health and safety is your #1 priority. It educates staff by ensuring that all child care staff are following the same safe sleep policy, because having a safe sleep policy is an opportunity to educate parents about safe sleep practices. It opens the door to a discussion between the parents and the child care provider about safe sleep positions. And by making sure that the child care providers are taking part in professional development and that they are always up to date on the best sleep practices. If there is a written policy to back up a child care provider, this empowers the child care provider to make the best decision for the baby. You can assure the parents that this is what you do for every baby. It helps reduce your risk of liability. While we don't like to necessarily think about it, there are an increased number of legal cases nationwide in which child care providers are being held liable for SIDS deaths. The following is an example of a jury award in a case in which a provider was held liable. In September of 2002 in Georgia, a couple was awarded $1 million in a wrongful death lawsuit for their 8-week-old son who died in 1996 after being placed on his stomach for a nap by the child care provider. The attorney argued that a child care center that does not place an infant on its back has been negligent. The child care provider plans to appeal, arguing that placing the baby on the stomach does not breach a standard of care. In Georgia, the standard of care is judged by what a reasonable parent would do. Unfortunately, SIDS does happen in child care settings. In some situations, grief-stricken parents have sued their child care providers, holding them liable for the SIDS death of their babies. While the number of SIDS liability cases is extremely small, this number is growing across the country. There are several grounds on which the legal cases surrounding SIDS deaths in child care have been based. Wrongful death, a legal claim based on the assertion that an act of negligence caused a person's death. Loss to society. When a baby dies, the opportunity for society to benefit from his or her presence and contributions, had he or she lived and grown to adulthood, is lost. A monetary figure is determined as compensation for this loss to society. Neglect. Until recently, SIDS was not attributed to child abuse or neglect. This has changed. Child care providers have been found to be negligent if they have not followed the safe sleep standards or the back to sleep recommendation and a baby succumbs to SIDS while in their care. Breach of contract between parent and provider. When a parent entrusts a child care provider with the care, safety, and well-being of his or her child, and the provider assumes this responsibility and enrolls the child, a contract is started. An infant's death attributed to neglect or breach of contract is grounds for legal action. As a professional or a business owner-operator, child care providers must remember that back to sleep is now considered standard of care. The following 3 slides list the elements of an essential safe sleep policy and explains the idea of tummy to play and back to sleep. The elements of a safe sleep policy include safe sleep practices and the creation of a safe sleep environment. We've already talked about all of these elements. Room temperature should be comfortable for a lightly clothed adult. Caring for our children suggests a temperature range of 65 to 75 degrees in the winter and 68 to 82 in the summer as being appropriate. Monitor sleeping babies. In childcare, you must check on babies by listening to and observing them while they are sleeping. The National Association for the Education of Young Children has adopted a 5-minute checking interval for NACE accredited centers. You need an unobstructed view of each baby sleeping in a crib. Checking on babies periodically will not prevent them from dying of SIDS, but will make sure that they are safe and sleeping comfortably. Parents do not check as closely on their sleeping babies as child care providers are expected to do. Have supervised tummy time for awake babies. Allow awake babies to be on their tummies to play and exercise. Be sure to observe them during this activity. If a baby falls asleep during tummy time, gently turn him or her onto their back for sleep, unless the baby is able to roll over from front to back and back to front by themselves. Teach child care staff about safe sleep practices and policy. All caregivers, including volunteers and substitutes, should be informed about safe sleep practices and follow the child care facility's policies and standards. Provide parents with a safe sleep policy. Tell parents about the steps that you're taking to provide a safe sleep environment for their infant or toddler. Have a copy of the safe sleep policy in your handbook and always review it during parents' orientation. Order free educational materials from credible organizations about safe sleep and SIDS risk reduction in childcare. Make these materials available to parents and post them on bulletin boards and in parent information centers. At the end of this session, we will give you contact information for ordering materials. Early on, child care providers should talk with parents about which sleep position is preferable for the baby. Anyone who is a parent and chooses to leave his or her baby in the care of another person should have a conversation with the caregiver about the baby's sleep position. When reviewing the baby's application, child care directors or owners should ask, what position does the baby sleep in at home? For babies that sleep on their tummies at home, they should ask why. If there is a valid health reason why a baby should not sleep on the back, the parents should inform the child care provider and discuss it with their child's health professional. Requirements around safe sleep should become part of the baby's care plan. If the baby must sleep on his or her side or stomach, you should know the reason for this from the child's health professional, because this may have implications for other procedures in your child care. The reason for a baby to not sleep on his or her back are extremely rare and should be discussed with the infant's pediatrician. You should therefore require a written, signed statement from the baby's pediatrician that states the reasons why the baby is exempt from sleeping on his or her back. Remember, the physician's note protects the baby and also protects you. Some child care providers might be reluctant to tell parents what to do and find it easier to give in to the parent's preference. It may be a good idea to designate a couple of people in the child care or the home facility to be the point person on back to sleep issues. When there is a parent that is concerned about the policy or difficult to handle, these point people can be responsible for speaking with them. If some parents insist on placing the baby to sleep on their side or tummy position, require a note from the infant's pediatrician that states the medical reason why the baby needs to sleep in a position other than on their back. Be sure that the note is dated and signed by the pediatrician. Have a medical plan in place. Keep the plan in a visible spot, such as on the wall by the crib, or at least in the room where the infants sleep. Be sure to place emergency numbers on or by each telephone in the facility or home, and to have a phone that is within easy reach to use in an emergency situation. Cell phones and portable phones have made it possible to always have a phone within reach. So what should you expect if a baby dies in your care? The place where an individual dies is considered to be the death scene. SIDS is a diagnosis of exclusion, and so it is necessary to complete a death scene investigation. You need to understand that there will be a complete investigation. Law enforcement officers will also need to take photos. Even though it's natural response to clean up or tidy up after something bad happens, don't do it. The officers will need to see everything as it was. The licensing agency needs to be notified. They will likely do an investigation as well to ensure that any failure to follow regulations did not contribute to the infant's death. Remember that they cannot use a SIDS death as the only reason to revoke your license. The coroner medical examiner will determine the case of death after the autopsy and death scene investigation. Some other things you should do if a child were to die in your care. Seek support and information from local, state, or national SIDS organizations. Provide SIDS information to the parents of the children in the facility. Provide age-appropriate information to the other children in the facility. And make resources for support available to families and children. The next 4 slides are scenarios. Write out your response to what you would do in each of these situations. This is a quote from a child care provider who experienced a SIDS death. We're ending with this quote because it's important for all of us to realize that SIDS does happen, and it happens in child care. The purpose of this workshop is to educate child care providers on what SIDS is and how to reduce the risk of SIDS-related deaths. Thank you for taking this course and for being proactive in your care for young children.